Hello, welcome. I'm Andy Carter. I'm the Member of Parliament for Warrington South, and this is another COVID Live Facebook Q&A session. We're here for about 30 minutes. We're going to try and answer as many questions as possible over the 30 minutes. If you want to send me a message, you can do so on the Facebook page, or you can email me as well. It's andy.carter.mp@parliament.uk, and all you need to do is mark your email COVID Q&A and it will pop up, and we'll do our best to answer it as we go through this little session here for about the next 30 minutes or so. Of course, you can write on the screen, as I said, as well, and just pop your details on here and we'll do our best to try and answer as many of those questions as we possibly can. We've got quite a few things to talk about today, actually, and lots of people have sent in questions already. So I'll do my best to respond to many of those as we go through this session. But I just really wanted to start by talking about what had changed over this week and the announcements that the Prime Minister made at the start of the week. We are about 7 weeks into restrictions, and lots of things have changed outside. We started this process with nothing on the trees, and suddenly we've got blossom moving into leaves. I've got a family of pigeons that have moved in outside my window, and we've all got longer hair as well. So, you know, the process of lockdown has taken its toll on so many of us. If by any chance you see a video of this in a couple of weeks' time and my hair has changed significantly, it's simply down to the fact that my wife has got some clippers. She's been practicing on the dog and has threatened to have a go at me as well. So that may radically change some of this here as well. So yeah, 2 months since lockdown started, people across Warrington have really been supportive of those restrictions, and genuinely very, very grateful. Thank you so much to everybody who has tried so hard to make sure that we here in Warrington are in a position where we are doing everything we can to ensure that we're following the guidance that has been put out. I think it's probably fair to say that it's very easy to get into a lockdown situation because the government just has to say stay at home, and it did that 2 months ago. It's much more difficult getting to a point where we're starting to lift some of those restrictions, and the details of what you can and can't do are changing over time. And I think that's where we are at the moment, and that's something that is going to continue really for quite a period of time. There isn't a golden switch that we can press that will change everything because of the nature of a pandemic. So we are going to see the rules change as we go forward, and we are going to see lots of new announcements coming through on a regular basis. And we've seen lots of announcements this week. You know, as we've gone through this week, we've had an extension to the furlough scheme that the Chancellor has announced that will see the process of furlough for businesses to run through until October, and there will be more changes that come with that furlough scheme as we move through the year. The self-employed scheme is now up and running, and if you are self-employed, you can log on and you can make a claim through the HMRC system. I think they've done a fantastic job to be able to get that system up and running ahead of time. But I'm very aware that a lot of people that are self-employed have not been able to make a claim yet. So lots of things to come, lots of changes to announcements will move through as well, and we'll try and keep you as updated as we possibly can. I post lots and lots of information both on Facebook and on my website, and my website is andycarter.org.uk, and we update it on a daily basis and put lots of information in there to try and keep people updated with the changes that are coming through. There are just one or two things that I wanted to mention at the start as well around contact numbers. Two, I think, that are really helpful at the moment. If you are going back to work and you are concerned and you're not sure about your rights as somebody going back to work, then ACAS can help. And ACAS have a brilliant website. They are the conciliation service, and they're a mediation and negotiation service for people that work all over the place in all kinds of industries, and they will do their best to help you. And there's a lot of information on their website, acas.org.uk. So that's the first thing I wanted to share. Second one is schools information, and there's a government advice line for parents to help people who are thinking about their children returning to school, and we're going to talk about that a little bit more in a second. 0800 46 86 87. 08000 46 86 87. 08000 46 86 87. I'll post that on the Facebook page as well in a few moments. If you're a parent and you're worried about schooling and you want advice, if you're not sure about the information that's being given out at any point as we go through the next few weeks, that Schools Advice Line is ran by the government, and they're there and they will give you that information. So there are a couple of contact points that people can get hold of if you want to sort of particularly pick up around employment or education. So earlier this week, the Prime Minister made some of those announcements to sort of start the transition of getting us back to some form of new normality. And he set out 3 principal areas that we were going to move into. Step 1 was very much around the first phases that came in from Wednesday. So the lockdown started on the 23rd of March, and what we haven't done is just lifted all of the restrictions. We've said there are certain things that you can now do. And one of them was around going to work. So if you can now go to work safely, you can do so. And that is particularly for people that cannot work from home. So if you cannot work from home and you can go to work, you can now do so. And the government have issued lots and lots of advice around how to ensure that your workplace is safe, information for employers and information for employees going back to work as well. There's links to all of that on my website, and the Health and Safety Executive have been charged with making sure that companies do follow that guidance. So if you are in any way unsure about the way that there is the right sort of advice for employers and employees, all of that information is on my website, and it's Public Health England and the Health and Safety Executive that will manage that and keep a watch on exactly what's going on there. So what are the three or four things that change this week? Well, firstly, spending more time outdoors is the big one. For example, sitting out in a park for as long as you want. There are now no restrictions on going outside to exercise. You can do that. You can also meet one person from a different household, but you've got to stick with the social distancing rules, and that's really important to stop the spread of the disease. You can exercise as often as you want. You can use outdoor sports facilities, for example, playing tennis against somebody else, a golf course. You can go fishing. You can do all of those things, but you've got to ensure that you follow social distancing, and that's the really important thing. And the other thing that's changed this week is garden centres have been allowed to reopen. So you can go out and you can spend some time in the garden and go and buy your plants and get away with putting the bedding plants in. Now, there was discussion about face coverings as well this week, and I'm going to talk a little bit more about that because we've got a question that's come in already on that one. So I'll come back to face coverings in a little while. Step 2 is the next phase, and that's not going to start before the 1st of June. That's the earliest that they're going to start to implement the next phase of some form of return to normality, and that really will be around ensuring that the safety of everybody involved in those next steps is paramount, and that we've checked to make sure that scientific advice is right. And that's where schools will start to return, a phased return for schools going forward. So reception, year 1 and year 6 in primary schools, and then also year 10 and year 12 in secondary schools. Now, it's not going to be like going back to school at normal. There are going to be a huge number of steps taken by schools, by head teachers, by teachers, to make sure that it's safe for children to do that. And I've spoken to the council today, I've spoken to head teachers as well, in terms of the steps that they're taking to make sure that safety is absolutely paramount. And at lunchtime today, I had a Skype call with the Prime Minister, with a number of other MPs as well, and he was pressed really hard on the issue around safety for children going back to school. And one of his commitments was very clear that if the scientific evidence did not show that it was right for children to go back to school at that point, then it won't be the case that they will go back, and they will relook at that and hold off asking children to move back into education. It's also about making sure it's safe for teachers as well, and that's right at the top of the government's list as well. So making sure that environment is safe. We'll talk a little bit more about that in a second, because again there are some more specific questions that are coming in around that. So in the next phase, there's also an opportunity to start to open some what have been classed as non-essential retail, so some shops, clothing shops for example. And then step 3 is where they'll be looking to open things like hairdressers, beauty beauty salons, pubs, restaurants, but that's not going to come before the start of July. So again, still a time to review and watch the science and make sure that we're in a position to be able to do these things very, very safely. Right, let's get to some questions. First one is from Vicky Shaw. She sent this in on email. My mum is in a care home in Warrington. Can she get a test because she doesn't have symptoms? Okay, Vicky, first of all, tests work best when you have the symptoms because that's where you will have the viral load. But of course we know that some people are asymptomatic, and the government have said that there has to be a major focus on testing in care homes. So we're particularly checking that residents and staff who work there on a regular basis are tested. We've had a mobile testing lab in Warrington, sorry, a mobile testing area in Warrington over the last few days as well. I know that there have been some delays in getting test results back, and my office and I have been working quite hard to try and pursue that with the testing companies to try and get the information back. But the answer is, if your mum is in a care home, she can have a test. It doesn't matter whether she's symptomatic or not. The care home has received these details. If there's any issues around that, then please send me an email with all the details in particular the care home, and also details of your mum as well, so that we can try and address that very, very quickly. Again, the council have got an ability to deal with these things as well, and direct the testing teams into the care homes. But it's also possible to be able to request the home test kits as well that can be used. Now, these are for people that we're checking to see if they've got the virus, not if they've had the virus. And there's a different test, and there's work going on that test at the moment. But you know, specifically around care homes, if your mum's in a care home and she hasn't had a test, there's no reason why she can't have one, and we will do what we can to make sure that she can get one. Right, let's move on to the next question. Susan from Penketh, she says, changes to the rules, does it mean that I can meet my family and friends in the park? Now, I had quite a lot of correspondence about this earlier in the week. You can meet one other person from outside of your household if you are outdoors, and this seems like a bit of a strange situation. Why are we saying only one person, not two, not three? Public gatherings of more than two people from different households are still prohibited. The scientific advice about meeting in public areas is because in fresh air the virus is less likely to spread, and I'm not I'm not really aware of the full details of how the virus spreads, but I do understand that if you are outside, the risk of spreading is much lower. It's been identified that no more than two people from different households. But I will say that, having spoken again to the Prime Minister earlier today, the scientists at SAGE are looking about creating what's called bubble groups to be able to identify different family households that could come together, and that there could be some sort of change in that. But that hasn't happened yet. At the moment, the rules are that you can meet one other person from outside from a different household if you are outdoors, and that's what's really the key message at the moment. Quite a few people have asked me about the R level in Warrington, and we hear the R level talked about a lot. That's the rate of transmission, or the rate of infection to other people. I can tell you that the R level is not published for Warrington, and I suspect it's not published because it's too small and the level of testing isn't high enough to be able to give a reliable R figure for this area. But there is an R level for the Northwest, and there are R levels for every other region around the UK, and that's published by Cambridge University. It's available online. I looked yesterday at the R level, and it was sitting somewhere around 0.7, 0.8, so below 1, which means that it's on a downward trajectory from where it was. And I think that is the key message here. The R level, I think, is being published for different areas, and we are seeing some variations. And I think we're going to have to keep a very close watch as we go into the next phases of what happens with that R level, and we'll be looking very closely on a regional basis as well. We keep seeing stories that Warrington ICU is struggling this week with the number of patients. Is it true or fake news? Well, I speak to the hospital on a very regular basis, and I speak to Professor Simon Constable, who's the chief exec of the hospital. the number of people that are being treated in our hospitals, and specifically in Warrington, is falling. There was a slight increase, I think, by one person in the ICU department compared to 2 weeks ago. I think it went from 10 to 11, but it's come back down again. So from the information I saw yesterday, there hasn't been any significant increase in the number of people being treated in ICU with COVID-19 symptoms. And in fact, I have to say the hospital has done a tremendous job of keeping people out of ICU because of the work that it's been doing with these sleep apnea black boxes. So I'm aware that there was some news coverage of this earlier in the week, and the hospital published a really good graph showing the number of people that were inside the hospital and in different environments. And I don't think that we're seeing any increase in the number of people being treated in hospital in Warrington over the last couple of weeks. It's actually going in the downward trajectory. Okay, let's move on to another question. Greta has messaged to say her mum is in Busey and is shielding. How long will that shielding stay in place? Well, the government has advised individuals that have very specific medical conditions to shield until the end of June, and that advice hasn't changed. They need to stay at home until the end of June. Although we're starting to see some of these adjustments for some people in society, if you are shielding, and if your mum is shielding or your dad is shielding, then they have to stay at home until the end of June. And there will be more information that's published as we get towards the end of June around advice for people that are shielding. That advice is staying in place because we believe they are at the greatest risk of serious complications from coronavirus, and as a result we're saying please stay at home, and if you know somebody that's shielding, please don't go around and visit them. It really is important that they are well looked after and isolated in their own home. Next question is from Gethin. This is on email. When will Cineworld in the town centre be able to reopen? Well, I think the first thing to say is there will be decisions that are taken by individual cinema operators when the restrictions are changed according to what they're able to do, their staff numbers and the environment that they're operating in. But the earliest that the cinemas in Warrington are likely to reopen is the start of July. And as we said a little bit earlier, that will all depend on the scientific advice that's coming through, but certainly not before the start of July. And I think one of the things that a lot of the film companies are doing, if you're missing watching a film, they're releasing them straight to Amazon and iTunes and things like that at the moment. So get yourself an Amazon account and you don't have to go to the cinema. That's my piece of advice for free today. Hannah is in Lim. She says she's lost a filling. She's lost a filling and wants dental treatment. Is it possible to go and see my dentist now? The answer to that is not necessarily at the moment. There are some emergency dental care centres that have been set up and you can get emergency dental treatment, but it depends what the issue is. They are dealing predominantly with emergency extractions, facial swelling, gum disorders, soft tissue infections. If you don't need to see a dentist, you're being advised at this moment in time to get in touch with 111 and they will be able to prescribe medication over the phone. Your dentist, your own dentist, may be able to prescribe medication over the phone. And if you do need to go and see an emergency dentist because you have a facial injury and it requires emergency treatment, there is a number to call, which is 0161 476 9651. 0161 476 9651. That's the regional centre and they will be able to guide you and tell you where to go to. And obviously there's the dental hospital in Liverpool, but you would do it if you're in Warrington through that phone number 0161 476 9651 and they will make arrangements for you to get emergency dental treatment if you need it. Okay, next question. Ben Sutcliffe on Facebook asks, are you involved in any talks between schools, the council and the local authority about reopening schools? Are you satisfied that schools in Warrington can open safely and for children, staff and their families? We did talk about that a little bit earlier. I have been speaking to head teachers. There are a range of views from some of the head teachers. I've spoken to the local authority this morning as well, and as I said, I've been speaking to ministers as well. There is a commitment that has been made from the Prime Minister that he will review this, and if we see that the scientific evidence when we get to the start of June is not right, then we will not go into a phase of opening schools. If we see that there is support from or the necessary support in place to ensure that social distancing can be maintained, that there are small enough groups, that teachers have all the facilities, then there is a plan to have some phased reopening. But for some children this year, it may mean that there is no further school this year. For others, it might be that there is a short-term return after the half-term break that's coming up, where they can go back into school on a regular basis. Okay, let's go for another question. Okay, Andrew says, we run a charity group in Great Sankey and we haven't had any help from the government. Is there anything that we can do? Well, without knowing specifically about the details of your charity group, it's hard to give you really good advice. And please email me with more details because you haven't told me what the charity group is. One thing I would say is that this week government have issued to councils more detailed advice about a discretionary fund of £600 million that will be allowed to support some charities. And that might be a route for you to get some help. So you may want to contact the local council, Warrington Council, and they may be able to give you some guidance. If you don't fall under that category, then there is also funding coming from DCMS for charities, and there's a specific fund that is through the Big Lottery appeal as well that might be available. But if you want to send me more details about your charity, I'll do my best to try and point in the right direction so that we can get you the help that you need. Just going back to that discretionary fund that we talked about a second ago, that £600 million, it's been allocated out to lots and lots of different councils. So Warrington Council hasn't got £600 million. They do have an allocation of it, and there is guidance now on the sorts of organisations that you can fund. So small micro businesses, those in shared premises, they have some discretion on some charities, and if you contact them, they will give you guidance. They're really the team that are working on it are really good at it, and they'll give you guidance. 443322 is the council's number, and they'll be able to give you some information on that. Question from Stuart Mann. If someone's worked at home with no problems for 8 weeks during the lockdown, can an employer force an employee back into the office against government advice? Okay, that's an interesting question. So there is a contract relationship that exists between an employer and an employee, and if there is a safe environment for work to take place, then they can request that you go back to work. If there is no reason why you can't work from home, and if you have continually worked from home during that period, then you could request from that employer that you stay working at home. And the instructions are at the moment that if you can work from home and there's no reason for you to go back into the workplace, then you should continue to work from home. If you can't work from home because you work in construction or manufacturing, then you should now return to work. In terms of people who can't get back to work because they've got childcare issues or something like that, then there does have to be some give and take. And the Prime Minister, I asked a question this week in the House of Commons on Monday when the Prime Minister made a statement, and I was very clear with him. If you have childcare issues and you cannot go back to work because the schools aren't open, is that something that an employer could take action over? And he said, no, they shouldn't. And if they did, then we would look to see what we could do about supporting anybody that was in that position. But we require employers to be flexible and reasonable and make sure that employees can continue to do their childcare duties, because it would be an impediment for them to be able to go back to school. Staying with workplaces, and I mentioned this earlier about the requirement to wear a face mask. Carol in Warrington has sent a message in. I'm returning to work next Monday. Do I have to wear a face mask? Okay, well, there are two things I want to say about this. First thing is about what is a face mask, and the most important thing that government is saying is you do not have to wear a medical face mask. We don't want people to be going out and buying lots of medical face masks to go back to work. They should be reserved for NHS and key workers that need PPE. What the government has said is that a face covering, a material face covering that you can make yourself, is a good idea, but it's not compulsory. So if you're travelling on public transport, if you're going into enclosed public spaces in particular, where it will be more difficult for social distancing, then they are saying it would be a good idea to have some form of face covering. And I think I've seen on the BBC and on other websites ways of being able to make them yourself. You can get an old sock and sort of cut it up and stick it around your ears, and it will work. It's not the same as a surgical mask. You don't need respirators. Those are things that are required for people that are working in PPE, but it really is quite important that if you are using public transport, or if you are in a workplace and you can't you can't fully social distance because of the way that it's happening, it really is quite important that you get yourself some form of face covering. Mark from Busey, I'm a self-employed gardener. Can I go back to working in people's gardens? Well, actually, you've never had to stop working in people's gardens. If you're working outside and you can social distance, you can continue to work. And that's true for any tradespeople that are operating. If you're carrying out essential repairs in somebody's house, you can also do that as well, but you have to follow instructions on safety and social distancing. So make sure you're well and you have no symptoms, and make sure that the person's house you're going into has no symptoms and is well. You need to make sure that you try and ventilate the area that you are working in as best as you can, and if at all possible, again, wear a face covering so that you're not aspirating as you're working. They're the really important things. I've got another question that's coming about employers making you go back to work. I think we've covered that one off. Employers and staff really need to have a conversation and agree working arrangements. If there is an issue around that, there is lots and lots of guidance on my website, and if you need my help, please contact my office and we'll do our best to help you in our office as well. But the information's all on my website as well. My son is currently living in university halls. Can he come home now? Well, I know early on a lot of students did return home. Then we had a period where they were remaining in halls. In general, if a student is moving permanently to live back with their family home, that is permitted. They can come home. If they have been moving, if they're going back and they can still stay there, again, the advice is they should stay there. But if they're leaving the university and moving permanently home, then that is now permitted to happen. Some more questions. Graham Smith on travel. Can workers travel to Scotland and Wales for work? The instructions that those devolved nations have given to people at the moment is that you don't have to return to work. The advice there is to stay at home. So if you are here in the UK and your workplace is in Scotland, you will have different advice to the advice that you're being given here in this country. Ruth in Stockton Heath. I'm worried about my job if children don't go back to school. Will I be okay to stay at home? Ruth, I answered that one a little bit earlier. The Prime Minister was really clear. If you can't get childcare and you are being asked to go back to work, then it is an impediment for you to go to work, and your employer should recognise that, and you do not have to go back to work until you can get proper childcare. Meg, who's in Warrington, will a parent be fined if their child doesn't attend school? Meg, the answer to that is no, they won't be. Government have said they're not going to take action against any parents, but they are strongly asking parents of the year groups that we talked about a little bit earlier, if they can go back to school, they would really like them to go back to school, because it will be to their advantage from an educational perspective to help them get back into a learning environment. And that's the work that's taking place at the moment, to make sure that schools are in a good place to be able to take children back and give them the support that they need in a safe way. Another question on children going back to schools. Of course, I also want to add in, a lot of children have been in school because they're children of key workers, that they have stayed in school all the way through this period, and it's absolutely right that we should recognise that lots of teachers have been in school all the way through this period as well, looking after children. My child is attending school, usually gets free transport. Will they still get this? Yes, local authorities are still going to provide transport. If you're under a free transport scheme, the local authority will be in touch with you and they'll make sure that you know all about how that's going to happen. Okay, final couple of questions then. Mike is in Chapelford. Why haven't airports been closed down? Why are still flights coming into this country? Mike, that's an interesting question. I've had quite a lot of correspondence about that this week. So let's specifically talk about Manchester Airport because I know I've spoken to the team at Manchester Airport in the last few days. On average, there are about 7 flights a day that are coming into Manchester Airport, and in total about 300 passengers. Now, most of those people are British nationals who have been repatriated back to this country. And if we'd closed the airports and said, I'm sorry, nobody can come back in, your friends, your neighbours who were overseas and on their holidays would have been stuck there and not able to return to this country. So we haven't stopped people flying back in if they are British nationals and they're returning home. What we also say is when they get home, they should follow the advice that was in place up until this weekend, go home and stay at home. The country's been on a lockdown. They've not been in a position to be able to wander around the countryside. They've been asked to stay at home. There have been no flights for holidaymakers coming to this country. There's not been a big drive for people coming into this country. It's simply been people repatriating British nationals, people that live in Warrington, that have been stuck overseas for a period of time, and in most of those cases they've been in confinement in the area that they've been waiting to get back as well. Now, some of these people have been stuck in hotels for 6 or 7 weeks trying to get back to this country, and because of the restrictions that have been taking place in other countries, they've not been able to fly back. So we are in a position where we've been able to fly people back, and then we've told them to go home. So I mentioned earlier 7 flights a day, about 300 people coming into the UK every day. Most of them are British nationals. Out of those 7 flights, 3 flights into Manchester are internal flights for key workers travelling from places like Aberdeen or Belfast. So if you've been working on the oil rigs, for example, flying back down from Aberdeen to Manchester. So I do think we've perhaps got a little bit out of context the number of flights that are taking place into. I mean, I live here under the flight path, and I can tell you, the moment I hear a plane, I'm looking up, and they're not happening at the moment. There's just not the number of flights coming into this country as you might be led to believe. I think one final question we'll take, and then we'll wrap up. Can I claim a grant from the council if I've applied for the self-employed job retention scheme? The answer to that is it depends, Jonathan. How your business is operating. Most of the grants that are available from the council are specifically to help people that have premises. So if your business has premises but you are self-employed, then yes, you may be entitled to a grant based on the rateable value of your premise. And if your premises are under the rateable value and you get 0 business rates, then you may still be entitled to a grant. Best thing to do is talk to the council and they'll give you full details of what you're entitled to do. But it doesn't stop you claiming for the self-employed scheme as well if you've had a grant. They're 2 different schemes. Right, we're just over half an hour. I'm going to start to sort of wrap it up and say thank you very much for all of the questions that have come in. I hope I've managed to answer as many as possible. If I haven't got round to your question, I'm conscious that there are still questions coming in. Please do send me a message on email and we will do our best to answer for you by email, send it out to you as soon as we get the answers. I check sometimes with ministers. I will talk with other colleagues to try and get the right answers for you. Sometimes it takes a few days to get those answers, but we'll do our best to get them. Final message, which I think is really, really important, is continue to follow government advice. The government advice is based on top scientific evidence, and Professor Whitty and Professor Vallance really are experts in their fields, and the team that are working with them in SAGE are pulling together incredible information and making judgments on a daily basis based on the science that sits in front of them. And I would ask you, as we've done for the last 8 weeks, please do stay safe, follow the guidance, and thanks very much for taking part today in this live Q&A on Facebook.